I'm Dr Raelia Lew. I'm a fertility specialist with CREI qualification. I'm the medical director of Melbourne IVF, and I'm the founder of Women's Health Melbourne, a boutique women's health and fertility practice. We now have 2 locations, both in Caulfield and Collingwood, which we're very excited about. I always knew I wanted to be a doctor, so I actually went into medical school straight from high school, and I completed my medical degree and went straight into training to be an IVF specialist. I knew that was my pathway and my goal. I undertook a master's degree in reproductive medicine, and I went on to do a PhD in reproductive genetics. I studied to be an obstetrician and gynecologist, and then I subspecialised in reproductive endocrinology and infertility. So my journey has been quite direct, and therefore over the 20 years that I've been a doctor, I have spent the majority of that time dedicated to reproductive medicine. That's given me a lot of experience, and I've helped patients in many different circumstances to achieve their goals, from egg freezing, fertility preservation for cancer patients, a holistic perspective on fertility treatments, from ovulation induction to IUI, IVF, genetic testing of embryos, and embryo banking for future family planning. I really enjoy every aspect of my work, and it's been my greatest privilege to help thousands of patients bring babies into the world. The first time I really discovered a love of fertility medicine was as a medical student, when I attended a lecture about genetic testing of embryos. That really blew my mind. I thought the science of testing embryos to prevent genetic illness and to allow families to form without that burden was such an amazing technology, and I immediately wanted to be part of this area of medicine to help women in that way. I went on to study as an obstetrician gynecologist, and I just developed a passion for treating women and making families happen, and that's really been the driving force behind my career since then. I enjoy every aspect of my work. I particularly enjoy when I help women freeze eggs and come back to use them to have babies. I have a growing number of patients from treating women over many years, and freezing eggs is something women do often when they're single and they're not in a position to plan a family immediately. When I have my patients come back to use their frozen eggs, sometimes it's to help them have a baby for the first time. Sometimes it's to help them grow their family, because when you start your family a little bit later in life, that means that often we do face challenges in having the number of children that we want. I find it so satisfying, and I'm proud to say that the vast majority of patients that I've treated who have frozen their eggs and who've come back to use them have had a baby under my care. I think of fertility medicine as really an opportunity to adapt creativity and strategy, applying scientific principles and evidence to help women and families achieve the goals that they dream to achieve. It's a really creative field in that way, and it's very flexible, and you can really adapt your practice to appeal to the values of your patient. So I really love that about this field. I also love that it's constantly evolving, and the opportunity to participate in research and to change our practice and adapt is quite amazing. And I've noted throughout my career many different technologies emerge, evolve and mature, and we've seen IVF success rates increase with the adoption of those technologies. So it's an exciting area of medicine to practice in, and there's always something that we can do to make things better for our patients. I like to find out all the important information that I need about that patient in order to help them. And so I like to cast a very wide net and look into every little nook and cranny as to what is going on with that patient, so that we can formulate a plan and help them succeed in their goals. I also want to form a therapeutic bond with my patients so that they trust me and so that I know them, and that helps me understand how I can best help them have a baby. One of the proudest elements of my career is having founded our practice at Women's Health Melbourne. It started as just myself and one medical secretary, and it's grown to become a multidisciplinary women's health practice with many practitioners across the entire spectrum of women's health, from helping people have babies, which is what I do, to managing all stages of life onwards to menopause and beyond. I'm also very proud to have founded Alchemy, which is a range of intimate care products for women, including Protectility, which is a lubricant formulation I designed specifically for those trying to conceive. Another career milestone of mine was founding Knocked Up podcast. I've been doing that for many years now, and I lose track of how many episodes we're up to. It's certainly more than 150 episodes at this point. And it's really about demystifying fertility and women's health, bringing the correct, accurate information to patients. Of course, you can never give personalised advice on the internet or on a podcast, but certainly we can inform and educate, and that puts patients in a less vulnerable and more empowered position, which is what I wanted to achieve with it. I really like what we're doing in the artificial intelligence space, particularly looking at egg freezing, for example. We can look with research at the eggs and gather information so that we can provide more personalised advice to patients as to how many eggs they should freeze, judging quality and predicting outcomes. That technology is being developed at Melbourne IVF, and we hope to be able to utilise it clinically in the future to guide our patients. We also use artificial intelligence to watch how our embryos are developing and give our scientists greater insight into selecting an embryo that's most likely to be successful for fresh embryo transfer. That's very exciting technology, and the accuracy is improving. So that's a space that I've seen develop over the last few years that is very interesting and exciting. Fertility challenges can be extremely emotional, and it can be very, very difficult even to reach out for help. I think when patients need help, when they reach out to see a fertility specialist, they often see themselves as a failure because they've not been able to achieve a pregnancy without assistance. And I say to them, you're not a failure, you're actually very brave. Coming for assistance is difficult, but we'll do our very best to help you. We've got an amazing team at Melbourne IVF, at my practice at Women's Health Melbourne, all dedicated to your success. And what we need to do is put our heads together, bring all of the tools we have at our disposal, and usually we can help.